Hello, I'm Dr. Mistry, founder of NAU Urology Specialists. I want to thank you so much for being interested in this webinar on prostate artery embolization. For those of you that are patients of our practice, and for those of you that hope to become patients of our practice, we have a holistic approach to urology. We want to make sure we take care of the whole person. I like to offer a number of different options for different urologic conditions. Today, we're going to talk about some unique options for enlarged prostate. There can be a number of reasons that people do not like the traditional options like TURP or even laser surgery, and we want to talk about different options. We are very fortunate to have Dr. Preston Smith as part of our practice, offering a minimally invasive approach for BPH. And Dr. Smith, go ahead and take it away.
Thanks, Dr. Mistry. I'm going to share my screen quickly, and we'll begin a short presentation on prostate artery embolization. Okay, so prostate artery embolization is a cutting-edge treatment for enlarged prostates through a totally different angle that we're going to talk about today. And then I'll talk a little bit about myself and what an interventional radiologist is. So I'm a vascular and interventional radiologist, and we are a separate type of physician from a urologist. So we go to a totally different residency and fellowship after medical school. I'm board certified by the American Board of Radiology. I did a fellowship in vascular and interventional radiology after a full radiology residency, and I've been practicing 100% clinical and procedural medicine for 7 years now. And my practice is mostly dedicated to men's health, which is a lot of prostate artery embolizations and some other things. So here's just a little bit about interventional radiology. We are a medical specialty that do minimally invasive procedures using some sort of imaging modality, whether it's live X-ray or CT scans. Now, today we're going to be talking about prostate embolization, which is done under live X-ray, but we also do things like treat kidney tumors or treat blockages of urine and kidneys using some other imaging modalities as well. Most of the procedures we do are inside of a cath lab or an angio suite. These are fancy words for a live X-ray room. And I just have some of the equipment that we use on here. We use an X-ray machine. This is a mobile one. And then we also have monitors that will show us the images while the live X-ray is going on. And here's a typical setup. So we have a team of people, a patient that is under the X-ray machine, and we're able to do things and watch them in real time. First, I want to go through a couple of terms that you'll find when you're doing research or talking about prostate embolization. The first is an angiogram. This is a fancy term for a dye study of blood vessels. And in this case, we are talking about arteries. So this is an arterial angiogram when we're referring to prostate artery embolization. Embolization is another word that you'll hear me say time and time again. And it's just a fancy word for blocking off a artery or a vein or some type of vessel. And then catheter is another term that I'll use a lot. Most people, when they hear about a catheter, they think of a Foley or a bladder catheter. But in this case, we are talking about catheters that are meant to be inside blood vessels and used for injecting the dye that's part of the live X-ray study. You'll also may hear me say fluoroscopy, and that's just another word for live X-ray study. So we'll just get right into the meat of it. Prostate artery embolization is an angiogram where we identify the arteries that supply the prostate gland, and then we place one of those catheters that's just like a long IV into the blood supply to the prostate gland, and we slowly drip small plastic spheres into the arteries to slow down the blood flow. I have a little schematic here that shows one of our catheters inside the artery that is supplying the one side of the prostate gland. And then in our next slide, you'll get an idea of kind of what these small plastic spheres are like in reference to red blood cells. So they're much larger, and we slowly inject them into the arteries that supply the prostate gland, and they will block them off or slow down the blood flow. And this really has one effect, is that slowly over the next couple of weeks, you will notice, as you see in these slides, that the urine is exiting the bladder easier as the prostate shrinks down. Here is just another schematic of us getting into the blood vessels. So instead of traditional surgery where we make incisions, we just use a needle to get access into the blood vessels that we need to go into. So this diagram on the right shows you a needle going into a blood vessel and a small wire going through that needle, and then a small access port that we run over the wire to get into the femoral artery and then have access into your arterial system. It's got a fancy word called the Seldinger technique, but that's how we do it. Next, I'll just go through a couple of cases so you guys can see exactly what we're looking at during the procedure. This is an angiogram. You can see one of our catheters here, right in the right groin. The bones you're seeing in the background are the patient's pelvic bones. And you can see an artery that we have placed this catheter in, and one of these dye studies, these angiograms that I'm talking about. Now, this is a typical picture of what we see when we're doing a prostate artery embolization. And I've done a lot of these, so I can tell you this is where the prostate artery is. And after we have done a dye injection and we identify where the prostate artery is, we work one of those very small catheters into the artery. And here you can see I'm just now seeing the prostate gland, and we're in a spot where it's now safe and appropriate to drip the small beads in and do the embolization. Now, sometimes it's simple like this, where there's just one artery supplying the prostate gland. Sometimes it's a little more complicated. And we'll drip those beads in until the artery looks like there's, or until the dye shows that there's no more dye going into the prostate gland. So you can see that now the dye is just kind of stuck in this main artery that's supplying the gland. Here's an example of the particles that we use for it. They're FDA approved for prostate artery embolization. We have a couple of options available, but for folks that want to know exactly what we're using, it's a common question I get. They are an acrylic that is linked with a gel, and that's just fancy words for soft plastic. The old ones we used to use were polyvinyl alcohol, and now the new ones are some proprietary, it's a proprietary plastic that each one of the different companies makes. Here's just one more example of an angiogram where we're identifying the prostate arteries. Like I said, it's usually just one artery aside, but in some cases, there can be several arteries that supply the prostate gland. And, it means that we just have to put one of those small catheters in each portions of the gland to make sure that the entire prostate is effectively treated. So now that you've seen what the prostate artery embolization procedure consists of, it's important to talk about why we do this. The most common reason why we do it is for men who have urinary symptoms due to an enlarged prostate gland. So these are really two main varieties. One of them is voiding. So if you're having trouble with a weak stream, or you have to strain to start to get urination going, that's one side of it. And the other one is a storage problem. So if you're holding on to a lot of urine and never completely evacuate your bladder and have the sensation of, urgently needing to go, or maybe even having some leakage if you can't make it to the restroom fast enough, or if you feel like you're going at too often of an interval or not able to sleep through the night because you're going. So those are all really good reasons to consider prostate artery embolization if you're having symptoms of an enlarged prostate. Some of the other reasons that you would most likely hear about prostate embolization from one of your other physicians is if you are having a procedure done as an adjunct treatment for prostate cancer, or if you're having bleeding due to an enlarged prostate, or if you simply can't tolerate the medications that you have been prescribed to treat your enlarged prostate symptoms. Next, we'll talk about who a good candidate for this procedure is. Really, it's anyone with an enlarged prostate, and the bigger the better. So if your prostate is 50 grams or over, or around double the size of what most consider to be a standard prostate size of 20 to 25 grams, then you're a good candidate for the procedure. If it's over 80 or 100 grams, you may even get more bang for your buck when we do the prostate artery embolization. And if your prostate is enlarged, but it's not quite up to that size, as long as you have undergone a workup by a urologist that shows that you do have prostate artery embolization, there's no harm in considering this treatment for your enlarged prostate gland. Who is not an ideal candidate for prostate artery embolization? It's a lengthy list I have here, but really it doesn't include a lot of people. So it's people with kidney disease that can't get IV dye, people with allergic reactions that can't get IV dye, and people with severe arterial disease that have had blockages of the normal arteries that we go through. That's mostly the reasons that we can't do the prostate artery embolization. What additional workup would someone need that is considering undergoing prostate artery embolization? Most importantly, I need to know what the size of the prostate gland is for reasons that we just talked about before this. This can be done through an ultrasound, typically done at a urology office, or if you've had an MRI or a prior CT scan that we can look at and measure the size of your prostate gland off of, we can use that as well. And then a lot of people that don't have very enlarged prostate glands that we are sure are causing their symptoms may benefit from a camera study done by the urologist, just to make sure that there is nothing else that is causing this, but we are assuming that it's the prostate gland. And this can be most commonly a stricture of the urethra that you can get for a variety of reasons. Now I'll just go through a couple of common questions that people will typically ask me when they are considering prostate artery embolization. How long does the procedure take? It's kind of a wide range. As you saw during those the slides of cases I showed you, you can have single prostate arteries on one side or multiple on another side. So the procedure times vary. Typically, it's a little over an hour. And this can be as short as 45 minutes or so, up to 2 hours if we have to catheterize a lot of arteries. From door to door in our practice, it takes people about 4 hours to get this, the whole process done. So, and this includes preparation time right before we go into the procedure and recovery time. We have all of our patients that we go into the femoral artery rest for 1 hour after the procedure, and then we get them up and walk them around and they're ready to go home. A lot of patients want to know if they're going to be put to sleep for the procedure. We use deep sedation. It is the same medications that people get when they undergo colonoscopy. So you'll be comfortable during the procedure. Most patients don't remember anything from the procedure. They just remember rolling in or rolling out of our angio suite. And people want to know how long they have to recover from the procedure or abstain from activities. And really the only thing that we have patients follow for restrictions is no heavy lifting for 48 hours. And that's just, a heavy bag of groceries in each hand, or about 15 pounds in each hand. And after 48 hours, you can resume all normal activities. This includes sexual activities. A lot of people will want to know when they can resume sexual activities. So that's the same time frame for that as well. Next up, a few things to talk about regarding the results of prostate artery embolization. So it works for about 80 to 85% of people. And when I say works, it means that it will bring your urinary symptoms down by at least half or more, and also bring your quality of life, which we score. It will bring that, elevate that as well, in addition to just the urinary symptoms. Improvement starts 10 to 14 days after the procedure, and you can continue to see improvements out to 3 months or so. And that can have to do with A, the prostate continuing to shrink down, and then B, also your bladder adjusting to an easier time kind of emptying itself entirely. Insurance mostly covers the procedure, which has been a long fight over the years, but every year more and more insurances cover it. Medicare and Medicare Advantage plans in Texas cover prostate artery embolization. The American Urology Society just recognized prostate artery embolization as a treatment for BPH. And most of the other private insurance carriers that are the majors also cover it as well. So in all likelihood, your insurance covers it. And if there's any confusion, we'll work with you to figure out how to make it work. And the best part about prostate artery embolization is that there's no catheter involved in it, and it does not have the risk of any unwanted sexual side effects that some of the other traditional treatments for BPH would have. So that includes retrograde ejaculation, any decrease in libido, or any leakage of urine after the procedure. Lastly, we'll talk about side effects after prostate artery embolization. There are not a lot of side effects, and essentially nothing that is permanent. A lot of people will experience what has been dubbed as post-PAE syndrome. I'm not a big fan of the term, but that's what it's been called out there. This boils down to mostly similar symptoms as people experience with a urinary tract infection. So some mild discomfort during urination, potentially some discoloration of your urine, some cloudy looking urine, and then maybe a little bit more difficult time with urination due to prostate swelling for the first day or two. And then after that, most patients will get over that in 2 to 3 days and then return back to normal and then start improving once they notice the urine flow getting better as their prostate starts shrinking around 1 to 2 weeks. Thank you very much for tuning in. Look forward to helping out any of you with enlarged prostate symptoms that decide on prostate artery embolization.
Excellent. Well, why don't you stop sharing your screen for just a moment, Dr. Smith?
Mm-hmm.
Excellent. So thank you so much for that very comprehensive overview of prostate artery embolization. I think a lot of our listeners may want to know why they weren't offered PAE by their own urologist, and I'd like to hear your take on it.
That's a good question. First, prostate artery embolization was recognized by obviously the Interventional Radiology Society. I didn't include kind of the history in here, but we have been doing this for around 50 years at some level. And until very recently, it hasn't been recognized by the American Urological Association, or the AUA, as a valid treatment for prostate artery embolization. Now, many of us have been doing this, and we know it works well. And it hasn't been used by some other urology groups because they don't do it, in addition to wanting to follow to a T the guidelines. But here we're lucky enough to where we work together and we're able to provide whatever treatment we feel is best for the patient and whatever the patient feels most comfortable with moving forward with. So we're kind of
your point is very valid. The idea that we have PAE integrated within a larger urology practice assures that an appropriate evaluation is performed and that any complications that may occur that are urinary related are dealt with in-house with appropriate supervision and expertise. Now, when a patient decides to get a PAE procedure done by a radiologist that's not part of a urology group, what are some potential obstacles and problems that can arise?
So there's stuff on the front end and stuff in the back end that can arise. So on the front end, as a radiologist, as much as I like to think that I don't need help doing anything, I cannot work up lower urinary tract symptoms as well as a urologist can. I just don't have the training, the clinical expertise. if someone has 160 gram, which is, eight-ish times normal size prostate and urinary symptoms, I'm probably qualified to tell you that that's what's causing it. But in someone with a mildly enlarged prostate gland, where several things can be causing the urinary symptoms, including the bladder, I need a urologist to evaluate that. Excuse me.
A lot of times patients will explore the issue with their insurance company and it be called experimental. But I tend to remind patients that Medicare pays for it. And oftentimes these commercial insurance plans use the experimental terminology to somehow make you think that your doctor is doing something that is either unethical or not approved. And I think that I just wanted to kind of reiterate that term experimental is a definition from the insurance company, not because we're actually experimenting on you. And understanding that your government payers are traditional well payers and cover prostate artery embolization is something that I want to make sure that all of our potential patients are aware of.
Yeah. I mean, most of the insurance companies, even though it's been approved by the American Urology Association, Medicare approves it, they will have this word experimental in their guidelines. And those are, just like you said, those are their guidelines, which they have their own reasons for having. So it's basically all of the societies that are medically relevant approve of this. And most of the insurance companies, they know this, so they end up covering it anyways.
Our out-of-pocket cost for this, if your insurance is not covered or you're not insured, is around $10,000. Is that correct?
Yes.
And that should include almost all of your anesthesia, your recovery, all your post-op. So
yeah, it's all in.
If you're interested or have been offered a cash pay price for this procedure in the past, then at least you know now that our cash pay price for the procedure is around $10,000.
Yeah, and that's a lot. I would be shocked to find somebody offering a better price than that. Like, to be frankly honest, that it sounds expensive, but most of the companies that I see offering this have a price tag of double that, or even more. So
I can't thank you enough for putting this together. We will love to have your questions and comments when it comes to this procedure. We would love to set up an appointment with you. And Dr. Smith, I can't thank you enough for setting aside the time for this important informational event.
yeah, you're welcome anytime.